Hey there, it's Dr. Justin Marcagiani. Welcome to Beyond Wellness Radio, where we provide actionable health information on a week-to-week basis that can help you improve your life. Feel free, head over to justinhealth.com, where we have various opt-in video series on more in-depth health topics such as female hormones, thyroid, and gut health. Also, while you're there, feel free and schedule a consult with myself, Dr. J, and or my colleagues. We're available worldwide to provide natural health support for any of your major health issues. Again, welcome to the podcast and enjoy the show. And we are live. It's Dr. J here in the house with Evan Brand. Today, we're going to be talking about vitamin D to help enhance your immune system. This is such a good topic because in the winter months, we're exposed to all kinds of virus and bacteria out there and immune stressors. There's less sunlight, more cold, more sugar, more sweets, more holiday stress. And we really want to make sure that you guys have a strong immune system to be resistant to what's happening in today's environment. Evan, how are we doing today, my man?
Doing really well. I'm ready for the sunshine to come back. I was looking at my D-Minder app the other day, and the vitamin D window just opened back up. So, which technically, according to the way the earth is tilting, we're actually past the deepest, darkest parts of winter. But, late December, because of northern latitude and the angle of the sun and all that, you literally cannot make vitamin D, even if you're outside butt naked. You just can't. But luckily, according to my app, the vitamin D window, at least for my latitude, just opened up about 6 days ago. So if there is sunshine out from about 12 to 1 or 2, there's a good 2 hours a day right now based on my latitude where I can get adequate vitamin D with enough skin exposure. But the problem is most people in the middle of the day, they're maybe on their lunch break at their office. You probably can't get outside enough to get the sun. And if it's cloudy, of course, that cancels it out. And can you undress enough at your office building to get enough sunshine, to get enough vitamin D? So in general, the answer is no. And this is why I would say 90% of people that we've tested via blood, we're going to see vitamin D deficiency. And this is just something you cannot afford to be deficient in.
110%. So in today's environment, with the winter being where it's at, and depending on your latitude and longitude and your ability to be outside and expose yourself, getting vitamin D naturally through the sun and it forming kind of these pre-cholesterol D3 and that D3 being absorbed into your kidneys and liver, right? Its odds are going to be pretty low. So we're going to have to supplement this time of year. That's going to be without a doubt. And we got to get our vitamin D levels up to an optimal range as well, because we need to be at least above 50 on the United States metric for vitamin D. That's important. If you have an autoimmune issue, if you have any cancer predispositions, you probably want to be even as high as 70 to 100, but at least 50 on the vitamin D side to really maintain optimal immune function.
And this is something you can actually test at home now, which is pretty cool. So there are some labs that you and I can work with where we can get people some dried blood spot testing. But if you're working with us clinically, we might as well just run a full blood panel looking into thyroid and everything else. Because if you have other symptoms, you could take vitamin D and not fix yourself, meaning it's great to optimize that, but you could still have other issues. So you could just do the at-home blood panel, or if we're going to get you to the lab, we might as well look at everything else. And you're not looking at an expensive test. It's kind of hard to believe that this is not standard practice, but you go to your conventional doctor down the road and they run basic blood work on you. They're not going to run vitamin D unless you ask for it. And even then, they may say, oh, it's not covered by insurance. So what is your reply? Because it's generally only going to be maybe $20, maybe $50 US max to test this. This is not an expensive test.
No, it's definitely not an expensive test. Now, in general, I'm going to give you guys a couple of markers here in regards to the ranges. So off the bat, I already mentioned 50 to 70 is a pretty good range to be in, I think, for most people, right? If we have cancer, heart issues, autoimmune stuff, we can go 70 to 100. And the metric we want to look for is going to be nanograms per milliliter. Nanograms per milliliter. In Europe, they do, or Canada, they do nanomoles per liter. And the conversion on that, I want to say, is about 2. You multiply whatever the level is here, and you multiply it by about 2.25, and that gives you that conversion, right? So if we're at about 50 or so on the vitamin D here is sufficient, right? That's the nanogram per milliliter. Multiply it by 2.25. That's about 125 nanomoles per liter if we're talking Europe or Canada. So you guys can make the conversion, 2.25. All right, so 50 to 70 is ideal. 70 to 100 is going to be, if we have cancer, heart disease, immune issues. Now, when we supplement with vitamin D, we want to make sure we're taking D3. If your diet's really great, lots of green vegetables, high quality ghee, butterfat, good K2, then you're probably fine. You don't need K2. If your diet's not awesome or you're not great, or you want that extra bit of insurance, you can always do vitamin K2 with your vitamin D, just to make sure there's an adequate balance there. A lot of your fat soluble vitamins tend to come and work together. Vitamin D and vitamin K work importantly well because K helps calcium get into the bone. D helps calcium be absorbed from the gut as well. So it's nice to have some K there. So we're really helping to put all that calcium back into the bone that we're now absorbing better in our gut from vitamin D. So it's nice to have that as an insurance policy to make sure we're putting and telling that calcium where it needs to go.
Yeah, well said. I just put another paper in the chat for you if you want it. This was from 2006, and it was just talking about how there was back in the 1980s, a guy, Edgar Hope Simpson, proposed that a seasonal stimulus was intimately associated with seasonal epidemic influenza. And long story short, the fancy way of saying, hey, winter comes and then boom, all of a sudden, viruses become more of a prevalent issue. And then long story short, there was this whole interventional study, which there's many on this. Long story short, vitamin D is reducing the incidence of respiratory infections in children. So this is specifically talking about kids, but there are countless of these for adults. And so what's happening when the vitamin D levels are sufficient are a multitude of things, but in particular, it's helping to reduce interleukin 6, which is one of those inflammatory cytokines that we're seeing get people in trouble. So if you can reduce your cytokines, that's going to be beneficial. And then also another cool benefit is not only as sort of an antiviral, but there's some antimicrobial benefit, which I honestly didn't know much about this until I started reading these papers here, that it can actually activate your immune cells to produce some antimicrobial. So sort of like a natural antibiotic, if you will, by upping vitamin D concentration. Now, the question is, well, how do people take it? Is it just an ongoing thing? If you think you're getting into trouble with illness, do you go high dose of it? I think it depends on what your levels are. So would you say you probably want to get a baseline first to know where you're at and how you should address it, or just go for it now?
Baseline first. I mean, I would say the whiter your skin is, the more fair your skin is, probably the more efficient you are going to be at converting vitamin D from the sun, right? The darker your skin is, think of the darkness in your skin, that's melanin, right? The more melanin you have, so you have kind of different spectrums. Full on African American, that's the highest amount of melanin. Melanin is like your natural UV block, right? It helps block your skin from the sun's rays. So due to evolution and where we evolve, people that evolve closer to the equator, more UV light based on the angle of the sun hitting it, they naturally evolve with more melanin in the skin. People that evolve further away from the equator, less direct UV light, less melanin in the skin, because it's all about making vitamin D. And so the more efficient you are at making vitamin D, you probably are going to be, you'll probably be able to get away with not supplementing as much or as frequent. The more melanin in your skin, the more you have to be on top of your vitamin D, because unless you're going to be outside 6 to 8 hours a day and you're at a mid to low 30 latitude, you're probably just not going to be able to ever make enough vitamin D. Therefore, you really have to be on top of everything in your testing. So lighter skin, I think in general, a good rule of thumb is 1,000 IUs per 25 pounds of body weight, especially in the fall and winter months. And then if you want to take a break in the summer, that's fine. Just make sure you get a test here or there to confirm it. The darker your skin is, you may even want to double that in the winter months. And then you may want to follow up and retest come the early spring and see where you're at, kind of monitor where you're at. If you're someone that works outside, you have to make that adjustment. If you're an office person, you're inside all day, you also have to make that adjustment too. So in general, 1,000 IUs per 25 pounds of body weight. And then if you have darker skin, you may want to double that for the winter months. And then it's always good to confirm sometime in the winter and sometime coming off the winter, early spring, summer, to see where you're at. And then we can always adjust accordingly. And if there's any risk of autoimmunity or cancer, we probably want to be testing just a little bit more frequently. Once you kind of know where you're at, you can kind of guess based on how well you're doing. And then in regards to vitamin D, vitamin K, K2, you probably want anywhere between 100, 150 micrograms of K2 is kind of where you're going to be at per day on average. And so if you're doing lots of green vegetables, if you're doing sauerkraut, fermented foods, you're doing K2 from grass-fed butter or ghee, you'll probably be fine. And then if you want that insurance policy of about 150 micrograms, you can always just find a good vitamin D3 with that in there, and then that gives you that extra assurance that you're okay there.
Yep. And the other cool thing about this, I mean, in terms of how big of a game changer this is for
Mm-hmm.
your health, for your immunity, we're
Totally.
talking minor dollars for testing. We're talking minor dollars for actually buying something. Now, we're still going to advise you to go with the more professional product just because that's what we're going to use clinically. That's what we're going to sell to people. So we still do want you to get a good quality product, but in a pinch, could you get away with something just a typical store-bought brand? Probably so. We just have a lot of sensitive people, so we're going to want to avoid a lot of the fillers. You'll see soybean oil sometimes. You'll see other things that we don't like in some of the cheap brands. So we're going to try to get you just like a straight D3, possibly with a little bit of gelatin, but even sometimes we're going to do like a veggie cap when you've got maybe a little bit of cellulose. But
MCT oil or olive oil, some kind of a healthier fat versus, like you mentioned, a soy or something more junky or more like polyunsaturated.
yeah, but once again, I mean, you're looking at in general, I know some of the professional brands you and I use cost wise, you're looking at like 50 to 60 bucks for 6 months. So, I mean, you're talking maybe 10 bucks a month, and that's for like professional quality. And there are liquid versions that you can use for children as well. I've got both of my kids taking vitamin D. Now, we do give them some different cod liver oils and omegas. So you can get some vitamin D naturally from some of the
Yep.
cod liver oils. You can get a few thousand IU, but we are still doing a little bit of extra K1, K2, and D3 for the kids. And that's easy. And my daughter calls it hummingbird food because it's clear, just like our hummingbird food, and it tastes a little sweet. So she loves that. It's like her favorite part of the day.
Yeah, because it's got a tiny bit of stevia in there, right? And then you also have, it's clear liquid vitamin, like the MCT oil in there. That's fun.
Yeah.
Good.
Yeah.
Excellent. Yeah. So 100% on that. I would say supplementally, like you mentioned, cod liver oil, very good. You can also look at other fat soluble vitamins. The other ones may be vitamin A, right? So if you're doing high quality ghee or grass-fed butter, you're probably getting a good amount of vitamin A in there, especially if you're doing some in your tea or coffee in the morning. If you're eating good grass-fed beef and you're doing good quality pasture fed egg yolks, then you're going to be set on a lot of that. If you want some additional insurance, you can do some cod liver oil, like I mentioned. You can get a vitamin D that has some vitamin A in it, or just use some of the extra cod liver oil and get some good egg yolks in, and you'll probably be totally fine with that. Anything else you want to add, Evan?
Yep. I would just encourage people not to do. Yeah, I would say I just encourage people not to do the conventional D2 supplement that you're going to get from a local doctor. For example, if you ask your doctor down the road to give you some vitamin D, they're probably going to give you D2. They may give you like a 50,000 IU or possibly even like 100,000 IU that you're going to get from a pharmacy. It's going to be loaded with a bunch of binders and fillers. And we find that just those really high doses for a few days don't really do as much as a lower dose over a longer period of time. So it's not where you just come in and do 100,000 for a week and you're cured. No, you really need to just optimize it over a slower period of time.
Yeah, like myself, I'm not going to lie. I'll do sometimes 40 or 50 once a week to kind of keep my levels pretty good. But I think it just kind of depends on where you're at, right? So if for some reason, you forget to do your vitamin D, I'd rather have people do it like at least once a week so it's there, because it is a fat soluble vitamin, so it will kind of build up in your system. It's not like a B vitamin where you'll just pee it out. But ideally, every day is good, especially in the morning time, because think about it, you wouldn't naturally make vitamin D in the middle of the night or at nighttime if you're taking it, right? You'd make it more in the morning to afternoon. So take it more in the morning and afternoon, right? That makes more sense to me from a kind of day in, day out, how vitamin D will be made in general. And then the other thing is, if you missed it or you forget it, I think doing it, at least getting it in there once a week as a fat soluble vitamin, just make sure you test, make sure you're doing well on that. And like you said, Evan, D3 is going to be, that's more of the animal version. I think there's a lanolin, more of a plant version on the D2 side. And the thing with it's more synthetic, and it doesn't equate to improving your vitamin D levels because it has to get converted in the body. So there's a conversion issue that tends to get lapsed on, and it won't move your vitamin D levels as good.
I have seen some like vegan D3. I want to say they're
Yep.
like an algae based product.
Yep.
I haven't looked too much into them. I mean, I have had some vegan clients who are like, hey, I'm just really opposed to any other source of vitamin D. I'm like, okay, fine. We'll get you some of the vegan ones. I think it's a lichen. maybe a lichen or an algae. I mean, I'm okay with it, but I don't have enough long-term evidence to say where I've looked at people in regards to their test results to confirm that their levels were getting up from the algae or the lichen-based one. I'm sure if it's D3 and it says 5,000, I mean, in theory, it's good enough, but I don't have enough data to say whether you should go for that or not. I would just go with your typical D3.
100%. Now, vitamin D has a couple of different benefits. You already mentioned a couple things. Let's kind of go over some of the benefits for the listeners. So we already chatted about the natural antibiotic that's being produced by vitamin D. It's called cathelicidin. It's a kind of an antibacterial enzyme that's super helpful at being able to knock down bacteria. Okay. It also has antiviral mechanisms as well. It has the antimicrobial peptides, like I mentioned. It also has some antiviral mechanisms. Part of that is it stimulates and can modulate the Th1 immune response. And the Th1 immune system, that's where you're making a lot of your natural killer cells and your helper cells, which are really good. And then also good helper cell can also help, your antigen presenting cell can help make antibodies more efficiently. So you're also going to have better Th2 immune response. So you're going to make antibodies to whatever that infection is. Those tend to come a little bit later in the game, but good signaling to make your antibodies is super helpful as well. I would also say there's a couple other studies here that were talking about different things. So we have a reduce in our MMP9 concentrations. We have a reduction in bradykinin storm and a reduction in our cytokine storm. So basically, we have a lot of inflammatory molecules that get produced, right? Bradykinin, cytokines, interleukins, MMP9. And basically, these are inflammatory type of chemical messengers. And vitamin D can help modulate that and prevent that from being overproduced, because the more we overproduce those, the more our immune system responds, right? And we can create more cytokine storm issues because our immune system kind of is on this positive feedback loop, responding and creating more issues with these cytokines. So we can kind of modulate and bring these cytokines down a bit. And when there's less cytokines, there's less chance of a cytokine storm, which is basically our immune system responding. And imagine a fight between two people. One person yells at the other person, that person yells back, then we're pushing, then we're shoving, then we're hitting, and the violence escalates. That's kind of what happens with the cytokine storm with your immune system and all the different cytokines and immune chemical signaler. So we can keep that modulated a bit, which is very helpful. And vitamin D plays a really important role in that.
Awesome. I don't think there's really any other mechanisms that are important for this. I mean, I'm sure there's other stuff that we could pick out, but I would argue that, if you're darker skin in Canada, you're in trouble. If you're in New York, you're in Michigan, you're in Montana, you're in Seattle, Washington. I mean, even, extremely fair skinned people, Irish people like me, if you're that far north and you're not supplementing, I'll bet you $1,000 you're deficient. So it's pretty easy. It's pretty easy. This is so easy, but such a game changer. I wish it were the front headlines everywhere.
Well, I would at least kind of convince people here, just get on vitamin D from Thanksgiving to spring.
Yeah.
At least do that, right? At least make that investment, get on vitamin D supplementation from Thanksgiving to spring. Right? If you want to come off the rest of the year, as long as you're getting some sunlight, fine. But at least do that. That's going to give you a good bump. And the fat soluble nutrients you'll get over those 4 or 5 months will hang around months afterwards too, because it takes a while for that vitamin D level to build up. Now, what are some symptoms of vitamin D excess? So if you're not testing and you're just doing a lot of vitamin D, well, you may have high levels of calcium. You may notice hypercalcemia. So if you run a comprehensive metabolic panel, you may see high levels of calcium. You may also notice you're more nauseous, you're vomiting, you're weak, a lot of urination, bone pain, kidney issues, calcium stones. If you're having any of those symptoms and you're not really monitoring your vitamin D, you may want to just double check on that. I've also seen clinically that vitamin D toxicity happens less when you have other fat soluble vitamins present. So if you're noticing that, you may want to back off a bit and you may want to really focus on getting good vitamin A and good vitamin K in there as well, just to make sure you're not creating a fat soluble vitamin imbalance. I think is a really good kind of thing out of the gates.
Yeah, that's pretty easy. Oh, a couple other things I wanted to mention. This was at the top of the paper you and I were looking at. You already mentioned benefits for autoimmune diseases like MS, but also in regards to just helping with epigenetic switching. So I'll just read it
Totally.
here because it's pretty simple. Vitamin D is a powerful epigenetic regulator influencing more than 2,500 genes. So what that tells me is you and I, seriously, we don't even fully understand what all this benefits. I mean, we have a clue based on knowing how many genes it can positively influence, but who knows? You don't know what you don't know. So how many other beneficial things are we doing that science hasn't even uncovered yet? Probably a ton.
100%, right? So when you talk about the different epigenetic signaling that can happen, that's pretty powerful, right? Because we know that I think 800, 900, it's a bunch of different DNA, a bunch of different genes are being affected. And so it's important. We don't know all the things that could be affected, but we do know that if you get your vitamin D levels up, you don't really have to worry about everything that you're doing. That's kind of the important component there. You don't really have to worry about it. You just got to make sure that you're doing the right thing and you're set and you're pretty much good to go.
Yeah, I've got my grandfather testing his now.
Anything
Luckily,
else you
his
want to highlight there, Evan, on that?
well, I've got my grandfather. He's been on vitamin D for several years now, and I've got his doctor to the point where he doesn't question it anymore. He just runs it. So we've got him up. We just got his blood work back. He's up around 60, and he's doing 5,000 units a day, and he's hanging out around 60. It took a little while to get up there, so we did 10 for a while, and then now we're just staying at a baseline of 5 a day, and he's doing great with it.
That's great. So can you repeat the dose again?
Yeah, we had him at 5,000 a day. For a while, we went up to 10 because he was only at around a 30 or a 40. So we went up to 10 for a little while, and then we backed him down. So now he's at a 5. So we went 5 up to 10 for a while. Now he's at a 60. So now we're just going back down, sticking with a baseline of 5,000 a day with K. And it's working really well.
So with my kids, they get some vitamin D out of the gates every single day, which is helpful. And then we make sure they get some cod liver oil. And then they're also getting some really good fat soluble vitamins via ghee and such like that. And so out of the gates here, anyone that's supplementing their kids or their family or friends, just make sure you're getting other good fat soluble vitamins along with the vitamin D. And you're going to be pretty darn safe out of the gates. And I would say at least try to do some kind of testing going into the winter and or coming off the winter, just to make sure you're on track.
Yep. And we'll put some links below. I believe you've got a professional vitamin D that you use. I've got one that I use. There's liquid. There are different soft gel capsule versions. So we'll put a couple links for people if you want to check them out. Once again, this is one of the most cost effective, but most health impacting supplements to be using at this time. And I think it should be in your pantry, in your cabinet.
I think so too. So out of the gates, we talked about all of the immune benefits, the immune modulating benefits. We talked about the natural antiviral, antibacterial mechanisms. We talked about how they modulate cytokines, decreased chance of a cytokine storm. We talked about the modulating of all these different chemical messengers. Also important benefits in regarding breathing, right? Because we talked about vitamin D can help modulate high levels of angiotensin, right? So we have a lot of blood pressure medications, angiotensin converting enzyme medications, right? Or ARB, right? Angiotensin receptor site blockers. Vitamin D modulates angiotensin to renin, right? It modulates it, and that can help with blood pressure. And blood pressure is important, right? Anytime we have respiration issues or breathing issues or blood pressure issues, modulating that can help, right? I would say the only other thing I really like adding in, especially if I'm having breathing issues outside of vitamin D, is throwing either in some glutathione or some NAC and or both, because that can, one, help reduce mucus. When you have less mucus, you have better transfer of oxygen from the alveoli to the bloodstream, right? So you kind of take deoxygenated blood, bring it back in, get oxygen. So you just have better transfer of oxygen back into the bloodstream, which is important. And that's going to help you breathe better, and it's going to help keep your oxygen levels up. If oxygen levels drop too much, you're going to be really fatigued and tired. So the only other thing I would throw in with vitamin D is maybe some NAC and or some glutathione.
Yeah, well said. Yeah, oral and or in bigger situations, more problematic situations, nebulized glutathione. We had one client who had a brother who had a lot of issues, got him on the nebulizer with the glutathione, and he was stellar within just a few hours. So I think that is another essential supplement to keep in your pantry.
Yeah, I had a patient just last week. She'll probably listen to this podcast, but she had some breathing issues due to a winter cold, some significant breathing issues. And she had seen my podcast and video on using liposomal or using nebulized glutathione. And I have my little nebulizer right over here, right under there. And I use the nebulized glutathione with some saline solution. And she said right away, her ability to breathe and respirate improved right out of the gates. And so it shows that, getting really good glutathione, obviously orally into your body is low hanging fruit. But if you need to get it internally right to your lungs, there's a lot of studies on showing how beneficial that is in helping your breathing and just helping to reduce inflammation in your lungs.
Yes, absolutely. Yeah. My mother-in-law, she had diagnosis of COPD, even though she's never smoked. We think it was due to chemical exposures, probably viral, bacterial issues as well. Same thing, got her on the nebulizer. She said it's a game changer. She got off of her inhaler completely after using the nebulizer. So it's pretty unreal.
Absolutely. So what we'll do is we'll put some links here. We have some vitamin D products and glutathione products that we like and we personally recommend. We'll put some links here below. So if you guys are interested and you want to take a peek, and you want to support the podcast, that's one way to do so. And again, we only recommend products that we personally use with our family, ourselves, and our patients. And because we're in the thick of it, rolling up our sleeves, dealing with patients clinically every week, let's say it's part of our best interest to have the highest quality products so we can get the highest clinical outcome.
Totally. Well, if you need help clinically as well, if you need advice, we work around the world with people via FaceTime, Skype, phone, etc. You can reach out to Dr. J at Justin Health, justinhealth.com for Dr. J, me, Evan Brand at evanbrand.com. And we're available worldwide. So you can use the scheduling links. You can book intro calls. You can book new client calls, but we are here. So please reach out if you need help.
Awesome. Hey, Evan, excellent chatting with you, my man. JustinHealth.com, evanbrand.com. Sharing is caring. If you guys enjoy it, please send us a review. We really appreciate it. JustinHealth.com/iTunes, evanbrand.com/iTunes. We'll put a review link below. We really appreciate you guys. All right, you guys have a phenomenal day. Take control of your health. Keep your immune system strong during the winter months. Take care, y'all. Bye now.
Got a question for Dr. J? Go to beyondwellnessradio.com and click the questions button. Then tune in to hear the answer. Also, if you like the show, click below to review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.